Well, prominent epidemiologist Professor Salim Abdul Karim says while South Africa has done well to flatten the curve of COVID-19 infections, it cannot escape the epidemic. Karim, along with Health Minister Dr. Zweli Mkhize, briefed the media, briefed the public as well last night following the meeting of the National Command Council on COVID-19. South Africa now has 2,272 confirmed coronavirus cases. That figure is up by 99 from the previous count. Now, Dr. Mkhize said 2 more people had died, bringing the number of deaths to 27. This includes the first reported death of a patient who had no underlying medical condition but succumbed to the virus. So the scientists have warned of the devastating effects of COVID-19 in South Africa should the lockdown be lifted abruptly. And they say the lockdown has given South Africa time to actually prepare for an increase in cases.
The latest number of positive cases today is recorded at 2,272. That means we've got 99 new cases recorded. So that's the latest total, 2,272, with new 99 recorded for today. Regrettably, we have also recorded 2 deaths that we are now able to confirm at this point. One from the Western Cape, and a male who is 68-year-old who came in acute respiratory distress and hypoxia with underlying concomitant diseases of diabetes, hypertension, and chronic renal disease. But the one in Gauteng is the one that's raising quite a bit of concern to me. Is a 57-year-old male who has been was admitted in acute respiratory distress, was taken ultimately to ICU, and then his chest X-ray showed some changes which were suggestive of COVID and of course COVID-19, and was confirmed to be positive. And whilst in the ICU, his condition took the turn to the west, and unfortunately we lost him. We do not have the record of any of the underlying diseases.
We cannot escape this epidemic, not unless South Africa has some special protective factor. Let's call it a mojo. We have some mojo that protects us that's not present anywhere else in the world. Our population is at high risk. We know that if we end the lockdown and we end it abruptly, we may run the risk of undoing all of the effort and the benefit we've achieved. Because then we'll be putting high risk and low risk people together, traveling in the same buses, taxis, trains. We have to do something about that. We have to avoid that situation.
All right, so I want to get a perspective on that presentation by Professor Abdul Karim, and I want to bring in now Professor Helen Rees, Chairperson of the Health Products Authority. She's joining us via Skype. Professor, very good morning to you.
Good morning. Thank you.
What's your take? Look, we've got some good news, as I've been reporting, with regards to sort of flattening of the curve, so to speak, in terms of giving our healthcare system more time to cope with this. But we also got some sobering news as to if we end this lockdown, where we're going to. What's your overall impression with regards to that presentation?
I think we can't get away from the fact that this is a sobering situation, and no country in the world is going to escape this. However, what we saw yesterday was because we intervened early, it does appear that that trajectory that we saw going up very steeply has been able to be flattened. And this is what we were trying to achieve with the lockdown. So I think that that is good news, but it's very early. We're looking very hard at the data, and the epidemiologists, a whole army of epidemiologists are looking at the data, and modelers are modeling the data. But clearly the lockdown seems to be having an effect. Yeah. We all recognize that we need to do a lot more testing, which we're not doing enough of at the moment. The capacity is growing, and we're definitely wanting to do that. But we are early in our epidemic still.
Yeah, we're looking at this graphic that Professor Karim showed us yesterday with regards to the country level epidemic trajectories. And, you know, what he was talking about with regards to when you look at each country and the way the epidemic grows, we see once a country has reached about 100 cases, the epidemic grows at a rapid rate. And, you know, what is called this exponential curve. South Africa has a unique trajectory, we're told. Why?
Well, I think there are several answers to that at the moment that we're postulating. First of all is that we really did start quite early. Many of the countries that you see have had that very steep incline that we're seeing in places like the UK and the US started much later on in their outbreaks, whereas we started extremely early. So that's the one thing. The second is that our lockdown, you also probably picked up on the media, well, you are the media, but you picked up that other countries didn't have such a very hard lockdown as we have. I mean, we went for bust. We said immediately, as soon as we had the lockdown, that we're going to do it really in a very comprehensive and a very tough manner. And that social isolation and the distancing between people, it does appear to have had that kind of impact. So I think that those are two things. We started early, we were early in our epidemic, and our lockdown has been a tough one.
So South Africa was on an upward trajectory, and we were entering that exponential curve, as spoken about by the good professor, where the number of cases was increasing rapidly. Then, on the 26th of March, we're told it took a turn. And what we began to see is a decline in the number of cases. And we're told that each day's numbers offers a lot of variability. Why, Professor Rees, is it better to look at these numbers as, well, one would say, a moving average of numbers?
The problem is if you look at daily numbers, there are going to be all sorts of permutations as you look at them. One is how quickly are we getting results out from the lab? The second is, do we have new innovations such as the home-based visiting that's now happening? So what you're going to see if you look at a daily number, particularly because many new services and ideas are being settled down around testing, you're going to get this variability. You're going to get it going up and down. And it makes it very difficult to interpret what that means. It's much better than to have a 7-day composite number on an average, because we're going to be looking at this week after week after week. And in that way, we get a smoother, instead of sort of suddenly seeing a high and then a low. And those highs and lows, as I say, can be administrative in some cases, can be about new services, can be active case finding, all sorts of things will influence that. So the average is a better way to look at it.
Professor Rees, I just want you to hang on for a bit. We've got some news just coming in. It's very important news. You'll probably be interested in it as well with regards to the handing over of PPEs, it's personal protection equipment. The Gauteng Department of Health is receiving as eagerly awaited PPEs, much to the relief of many health workers. The hospital and clinic employees in the private and public sector have been pleading for this equipment since the outbreak of the novel coronavirus. It's currently happening. Professor, hang on. I want to take some live visuals. I'll come back to you in a short while.
The Johannesburg branch, the Gauteng government. And the virus is cruel and knows no border, but there is love among the people. While the COVID-19 outbreak in China, South African government and the people show the understanding, supporters, and the sympathies to us, and we will bear in mind. So is during his conversation with President His Excellency Mr. Ramaphosa in April 8, our President Mr. Xi Jinping stressed that is that China and African countries are good friends, good partners, and good brothers, who share the will and war, and comrades plus the brother is the symbol of the special friendly relationship between China and the South African, and between the two ruling parties. So the pandemic situation in China has been generally been placed under control. So, and we understand that in South Africa is facing the expanding situation and upholding the vision of working together to build up a common community with a shared future for mankind. So China is working together with international community to fight against this. At this critical moment, the China government and the Chinese people firmly support the South African government and people in fighting against the virus. So Chinese Consul General Office in Johannesburg encouraging all the Chinese companies to make contributions to South Africa government and the people. So the Bank of China is a world-famous enterprise in financing sectors. Today's donation shows Bank of China is kindness and social responsibility as a multinational company rooted in Johannesburg. So Chinese Consul General Office will working together with the Houchin provincial government to make more donations in coordination for more donations from Chinese side. So we expect that South Africa government people can win the earlier victory in fighting against the virus. Thank you.
As the department, at this moment, we are very grateful for the support that we are getting from the Chinese embassy in supporting providing our healthcare workers with this important protective item that they need as they go out on everyday basis to do the work that the department is currently doing of doing door-to-door and screening and testing our community members that requires the testing. And would like to say that we are very happy with this donation. It will go a great way in protecting our healthcare professionals and even the patients in some instances where this is required, as we are also having to use the masks in some of the patients in our clinics and hospitals as patients come in. So thank you to the Chinese government for the support.
Thank you, Bandita. Let me see Masugu.
I'm trying to maintain social distance. Thank you and good morning, everybody, and good morning to the CEO, the Consular General, HOD, and DDG Malirutla, and all of you. It is a great honor and privilege to receive this great gesture from the Bank of China. I think it's a great gesture that we are hoping that it's not going to stop today. There is more to come. And one thing that I have noted since I came here, there are almost 18 surgical masks that are worn by civilians, and actually 6 respirator masks that are worn by civilians. So we have made a call as a South African government that masks are quite important to save lives and actually to protect ourselves from one another. But it's also important that we also make the call that we have to reserve these types of masks for those who are at the front line, particularly our medical and healthcare workers. So it is important that we continue to educate everybody about the appropriate usage of the mask, because sometimes the mask does give somebody a sense of false security. Because if you are not using it appropriately and you are not using it in terms of how it's supposed to be, then we're going to have problems, So I'm hoping that the 18 masks that I've seen here, they've been done properly and they will be doffed also properly. But it is a good gesture, and I think from the People's Republic of China, it's an important thing that we have to get help from them and assistance. And also, it's not only about the mask. We had an initial engagement early in the month of March with the Consular General when we were starting off. I think we are still having few numbers of infected cases in the country and in Gauteng. We shared a lot of information, and we also agreed that we are going to have a lot of collaborative programs, particularly even in terms of our academics, particularly those who are treating our patients. In that line, I would also want to confirm to the public and to you all that yesterday we had our first what we call Mortality and Morbidity meeting, where we discussed all the cases that we have in Gauteng, and particularly those who have passed on, just to also share the experience across our centers, both private and public, on how best we can be able to treat and manage patients with COVID-19. And I'm hoping that in our next engagement, because we're hoping it's going to be a weekly engagement, that the Chinese academics and government will also come in so that they share more of the experience that they have. I think we can be able to overcome. We believe that we will overcome, and we will overcome without any much of casualties. And yesterday you saw that as a country we're having a unique pathway in terms of the disease spread and the pattern. And that pattern is the one that we are quite interested in making sure that it becomes a South African model on how we can be able to overcome the virus. But again, it's an important gesture, like I've said, and thank you so much. I'm hoping that we'll come again here soon, if not next week, to receive more. To receive more so that we get more of the assistance. These are important equipment for our healthcare workers who are trying by all means every day, every time, preoccupied with making sure that our frontline staff are protected and are able to work without fear of actually contracting the virus. And we have a couple of patients who are our own healthcare workers. Now we are starting to see, I think there are two of them who have contracted COVID-19 from the line of duty, but the rest of those that have been actually contracted, they've actually contracted COVID-19 from their social circles. But I think with this gesture and this mask, I think we have to take them straight to a facility. They must not even go to a storeroom where they actually will be in need and where it will be required. And thank you for the peoples of Republic of China, and thank again. And this is a partnership that we are grateful for. Thank you.
Thank you. I think let's get a photo opportunity with Mr. Lee.
Okay.
I don't know how heavy the box is.
No, it's not heavy.
Carry the box.
No need a box? Yeah, one box.
Yeah,
one
let's
box.
hand over to the
Over to you,
HOD.
Yeah, the HOD is you know that he's a carpenter.
He's a carpenter.
Much needed PPEs, the personal protective equipment, they're being donated. And we've got Professor Helen Rees, the Chairperson of the Health Products Authority, on the line. No doubt, Prof, you've been listening to this and emphasize for us the importance of these PPEs, especially for our angels, some will call them, on the front line, trying to fight against this novel coronavirus. If they don't have masks, for instance, as the basic tool, as the basic equipment, it will have such a huge impact on the population who gets sick, correct?
Correct. And in fact, it's one of the most important things that we can do. And it must be a very top priority is to protect our healthcare workers. In my own institute, many of the healthcare workers who were working on the HIV program have now started to work as outreach workers in the community, are continuing to work in clinics but focusing on COVID-19 now. And to keep our health care workers safe is going to be critically important. It's not only so that they can respond to escalating numbers, which we anticipate for COVID-19 patients, but it's also because all the other diseases that we have will continue, all the other chronic diseases. So it's incredibly important that we protect our healthcare workforce.
Professor, I just want to bring up one of the slides that was spoken about yesterday from Professor Karim's presentation to the nation yesterday. And he was talking about the three waves of the SA epidemic. And the first of which was the travelers who are acquiring the disease from other countries and brought it back to South Africa. And we're told that wave is coming to an end because international travel has stopped. You agree?
Yes, I agree. And certainly, I think that we all anticipated that. And we've seen the numbers go down, there are still some travelers who we know are still trapped outside the country because many countries have closed borders. So people are still, South Africans are still outside and wanting to get back. So there will be a few more over time coming back. But that big bulge that we saw in that blue line is coming to an end.
So the second wave is when the travelers interact with people from work. We talk about home, hospitals, etc. And then the third wave, which has to do with general community transmission, is when those travelers and their contacts interact with general population. This is the concern, isn't it, when we're talking about the spread of COVID-19, community spread?
That's right. I mean, one of the problems with the COVID-19 is that, first of all, you can contract the virus but have no symptoms.
Yeah.
Secondly, you can have it and be infectious before you develop symptoms. So the problem is, and it's highly transmissible. That means a lot of people are going to get it. So if you put all of that together, what you have is a large number, potentially a large number of people in the community who don't yet know they're sick, or who might have very mild symptoms but are infectious. And that's when you see this very rapid upswing. And that is why it is so important as part of our national strategy to actually go out and try and identify people who have the symptoms and test them, and then in one way or another isolate them so that we actually stop from that individual what we're seeing as transmission out, not only to one person, but if it's more than one person. If it's more than one person, then as you can imagine, the whole outbreak will spread and spread and spread very rapidly.
So we expected that exponential growth. That didn't happen with regards to new cases. We're told each infected person on average is leading to about one new infection. That's the good news in that regard. But if we end this lockdown too abruptly, we become very high risk.
Exactly. And I think part of what we're going to have to think about as we think about how we do transform the lockdown into sort of the next phase of a lockdown is what's going to be acceptable and actually still does what we want to achieve. If we can continue to rapidly identify, if we get real community sensitization that anyone with these symptoms needs to come forward and put their hand up and have a test, what we need to do is to make sure that somebody who has the infection doesn't spread it. And if we can get that culture in, and we all own that culture as a community, it shouldn't just be the healthcare workers looking, it should be something we own. And some of the ideas that are out there are using cell phone technology, and the cell phone companies have come to the party on this, to get people to actually look for themselves at symptoms and then be advised where to go to get tests. So we've got healthcare workers going out, we've got the cell phone companies coming in as well. But the ownership of saying, I think I'm not well, I need to have a test, has to be understood by every single one of us. It can't just come from the health sector telling us all the time or finding us all the time. We've got to own that.
Yeah, it's, some of the things that the professor was talking about yesterday was putting out these small fires before it gets to the raging flames, so to speak. I guess we're never going to get to a point when we wake up one morning and I come on air and my first headline on the news is, hallelujah, it's over.
We will get to that point.
Will we?
We will, but it's not going to be quick. And there are different ways that we might get to that point. One will be that over time, if sufficient numbers of people in the community have the infection and develop antibodies, that eventually when the virus looks for somebody who's vulnerable, it's run out of people because everyone's got antibodies, or sufficient numbers of people have antibodies that the virus can't replicate itself enough to continue. And that means that the virus over time will spiral down because there's what's called herd immunity, that our immune systems are now protecting enough people in the community so that the virus won't have anywhere to go. The other thing, though, and this is what we will need over time, is a vaccine. Because we also anticipate that we're going to have, this is the first wave that we're seeing in South Africa. We anticipate that we would have second waves of this virus. We also think that it's possible the virus might become seasonal and keep coming back. The only way then to get rid of this virus is to have an effective vaccine and to have a strategy, an immunization strategy worldwide. That means that people are protected against future infections. And in that way, we will see that this virus will slowly not disappear perhaps, but certainly not be doing in any way what it's doing at the moment.
So just to push you with regards to, eventually we'll get to a point where we can say we've dealt with COVID-19. I guess the billion rand question would be, how long does it take for a population to develop this herd immunity that you speak of?
Well, there's several answers to that. First of all, this is very transmissible. So if we did nothing, this would sweep through communities very rapidly. That would mean the mortality rate would be high, our health services will be overwhelmed, our social services would get civil disruption. It would be fairly devastating for any community, and really it would be very difficult to cope with. But that would mean that many people would rapidly get infected. In doing what we're doing, we're slowing that up. But there will still be transmission in the community. So we will see slowly the numbers of people with antibodies just through nature will increase. But that will take a long time. And if we left it with a lockdown type of mentality, doing what we're doing, it will take months, if not years, to actually get to that level of community protection. That's why we're looking for other solutions. We're looking for drugs that can protect people and against infection, and we're looking, as I say, for a vaccine.
Well, let's speak about these vaccine trials that are underway. Best case scenario is that we get it within 18 months. It might take a little longer than that. How is a person picked, Professor, to be part of those trials? Should they have mild or severe symptoms? How does one get involved in such trials?
It's a very good question. Remember that vaccines are protective. So what you're looking for with vaccine trials is actually people who are not infected. So you're looking for people in the ordinary community who haven't had the infection. And there are different stages to developing a vaccine. The first one is in the laboratory and with animal models, where you try and identify vaccines that look like they're going to be very good, what we call candidates, that they might have the potential to work to trigger an immune response in an individual, that if they in the future were confronted with the virus, that their body would remember and would be able to fight off that virus and they wouldn't get infected. So that's what we're looking for. When we have a vaccine that we think from the laboratory looks promising, the first thing we do is we do an early clinical trial where small numbers of healthy people, adults who volunteer, and these are often, say, 40, 50 people, small numbers in the first instance, will have the vaccine. And we're really looking then for a couple of things. First of all, is the vaccine safe? Safety is a very important question. Secondly, what kind of dose do you need to give to see an immune response in that individual? If all of those things are ticked, the next phase is a bigger number of people, often in places where you think you're going to see an outbreak. So, for example, at the moment in South Africa, if we had a vaccine, those kinds of larger trials that again could be anything from 50 but could go up to as many as several hundred, we would give the vaccine and we would look again, is it safe? Does it produce this immune response? And we start to look at, we have the beginnings of looking at whether it's working. And finally, the big trials that we see that are going to take thousands of people volunteering will be to see whether it is actually effective in protecting. And those trials will be done worldwide in lots of countries, and it'll be done with several vaccines because we can't back any one vaccine. We just do not know which one will work. So it'll be a worldwide. These will be worldwide studies with many countries participating, so we get the answer as quickly as possible.
Something that I found very interesting was the use of plasma, Professor Rees. Talk to us about that. Just break it down for us, our viewers can understand it better. And can the use of plasma, be that bridge that gap until the vaccine is here?
certainly people have been looking at this, and this isn't the first time we've had an infectious disease. The same happened with Ebola. What happens here is that someone who's had the infection has produced antibodies. Then blood is taken from them, and the antibodies are then given to somebody. Usually these are people who are sick. In the first instance, it's usually developed, first of all, to see if you can help very sick people from progressing to possible death. And so this would be the first sort of group. But you can also use these same antibodies to see whether they protect. And so both of those things would be looked at. The problem with these is that they're more expensive to produce and to produce at a scale which is what you would need with this kind of pandemic. And that's why a vaccine which tricks the body into producing its own antibodies to protect you is in the long term going to be the answer. But certainly these taking convalescent plasma, as you said, getting these antibodies and exposing and giving them to people is certainly one thing that's under being researched at the moment.
What about the medication hydroxychloroquine? I mean, it's been brought to the fore by, among others, Donald Trump, for instance, calling it, I guess, some sort of game changer. My understanding of it, and you correct me if I'm wrong, is that what this does is that it suppresses your immune system, so it helps better with regards to inflammation. That's a problem, isn't it, for people who have compromised immune systems?
Well, you're quite right that that's broadly the way that it works. But we also know in the laboratory that it does appear, if you look in cells, to have some sort of protective action against the COVID-19 virus. So for that reason, people have been very interested in studying it because it's an available drug, it's widely registered, we know about its safety profile, the manufacturing can be ramped up. Yeah. So for all of those reasons, people have been very interested in looking at it. So there are a couple of very big and important studies. The problem at the moment is the studies that have been done are small and there's not sufficient data to really tell us definitely with our hands on our hearts as scientists, that actually really does work. So we now need to do much bigger studies, and there are some very big global studies underway. One is using chloroquine and another of other drugs as potential therapeutics. So these are called randomized trials where patients who are sick in hospital will be given a series of different alternative therapies, and we will rapidly be able to see if any one of them work. If they don't work, they'll be pulled out. If they work, they'll be stayed in. They'll be kept in the study. But the other way that we're looking at chloroquine is to see whether people such as healthcare workers who are highly exposed to the virus, whether different doses could possibly protect against infection or protect against more severe disease.
Prof, thank you very much indeed for that vital information. We've got to go, but we appreciate your time. We'll no doubt have you back on the program to give us more insight into how we're dealing with this.